Healthcare Financing Review, a layman's guide to the US healthcare system. Abstract. This article provides an overview of the US healthcare system and the recent proposal for health system reform, prepared for a 15 nations comparative study for the Organizations for Economic Cooperation and Development. The article summarizes descriptive data on the financing, utilizations, access, and supply of US health services, analyze health system cost, growth, and trends, review health reforms adopted in the 1980s, and discuss proposal in the current health system reform debate. Introduction. This article was prepared for a 15-country comparative analysis of health system reforms in the 1980s in Organization for Economic Cooperation and Development countries. The Organization for Economic Cooperation and Development project follows up an earlier 7-country comparative study. This article pulls together basic structural information, reviews trends in the growth of health system costs and indicators, discuss the major health system reforms of the 1980s, and summarizes the proposed change currently being debated. As a part of this OECD project, a comparative study of all 15 countries is currently being written and will be published by OECD along with the individual country papers early next year. Overview. Financing. The United States spends more on health care services than does any other nations. On average, more than twice as much per person as the other OECD countries. These expenditures are financed by a complex mixture of public payers, federal, state, and local government, as well as private insurance and individual payments. There is no single nationwide system of health insurance. The United States primarily relies on employers to voluntarily provide health insurance coverage to their employees, and dependents' government programs are confined to the elderly, disabled, and some of the poor. These private and public health insurance programs all differ with respect to benefits covered, sources of financing, and payments to medical care provider. There is little coordination between private and public programs.